My name is Dr. Clifton Wickiser, and I'm a board-eligible chiropractic neurologist. So one of the things that we handle a lot in this office is dizziness. So what I want to do is kind of explain to you some of the different types of dizziness that you might be having or that we can help with, okay? So the first thing I want to show you is we utilize some goggles, and these goggles are called Real Eyes. And basically what we're doing, as you can see, we're looking at Layla's pupil here up on the screen here. So if I shut this shutter off, she can't see anything, but we can see her eyeball, okay? So what that helps us do is we do some different movements and different head movements to kind of show and look at how the eye responds. So as you see, when I turn her, we can see that she has a nice moving vestibular ocular reflex, okay? So that helps us differentiate different types of the dizziness. So the first type of dizziness that we work on and have very good success with is what's called benign proximal positional vertigo. So this is your typical vertigo. This is called BPPV. And so what this vertigo looks like is when you move your head, even when you stop, because crystals in the inner ear are stimulating the hair cells, think your head's continue to move when it's not. So what would happen is if Layla here had BPPV, when I spun her and stopped, a lot of times her eye would keep moving, okay? Or if we lay you back, you know, the most common is the posterior canal, probably in the posterior canal. So when you lay back to the right or to the left, your head goes, you start going into dizziness, into a dizzy spin. And then that takes a little while to stop. So we've had really good success with that one. The next type of dizziness I want to talk about is what's called cervicogenic dizziness. So this type of dizziness, this is coming out of the neck. So this happens a lot of times, for example, when patients are in a car wreck or they've had some type of whiplash trauma. And so what we would do with that patient is we look at their eye movements, then we have them turn their head to the right and left and recheck those eye movements. And if they have cervicogenic dizziness, it will make those eye movements worse. Okay, so this is a very good dizziness that we get very good results with, and also pretty much all chiropractic gets good results with it. So the next one is that we help a lot is what's called orthostatic presyncope or orthostatic hypotension. So with this one, this type of dizziness is the one that if you go to stand up real quick and your body feels off balance, okay? So it's not more of a world spinning, but more of just kind of a drunk feeling. So you go from laying to standing or sitting to standing. Also, a lot of times, this dizziness can be caused by blood pressure medications. It's a common side effect to blood pressure medications. So, but we've had very good success with helping that one. And then the last one, the most difficult type case is what we call Meniere's disease. And Meniere's disease is kind of a combination of the different types of dizziness, and it's more of an autoimmune issue where the body is attacking the cerebellum. Okay, so if you have any of these types of dizziness, please feel free to reach out to us. We'd love to talk to you and see if we can get you some help.